One of the biggest fears I hear from men diagnosed with prostate cancer is how treatment will affect their sex lives. That's a valid concern since erectile dysfunction can occur in all prostate cancer treatments today. In surgery, because the nerves that control a man's ability to have an erection lie next to the prostate gland, they can be damaged or removed during surgery. Sometimes these nerves can be spared during surgery to preserve erections. In radiation therapy, erectile dysfunction can be a side effect as well, occurring in about 30% of men who previously were able to achieve an erection. The development of erectile dysfunction depends on the patient's status prior to therapy, including age, ability to have an erection prior to treatment, and whether or not testosterone-lowering drugs were used along with radiation. I remember my anxiety about my sex life and about my life in general when I was first diagnosed back in 2007. I'll never forget the day my urologist called me and told me I had prostate cancer. I was shocked and scared. I went straight to the internet and somehow found this guide, Questions and Answers About Curing Prostate Cancer. As a data-driven man looking for a cure, I found information about prostate cancer from most of the well-known cancer treatment centers in this country. Unlike much of the medical journal information I found, this guide is written in a way that I, as a non-medical industry person, could actually understand. The guide was written by Dr. Frank Kreitz of Radiotherapy Clinics of Georgia, who have treated over 14,000 men from all 50 states, including yours truly, in December of 2007. Inside, you'll find answers to over 100 questions, many of which I would have never thought to ask the physicians during my 5 consults. You'll learn why fully understanding your biopsy pathology report is so important in your determining what treatment is best for you, and even whether you should consider active surveillance, no treatment at all. You'll learn about the cure rate probabilities for many treatment methods, and how most physicians define prostate cancer cure as getting to or maintaining 0 PSA 10 years after treatment. Once I understood the concept of cure rate probabilities and side effects probabilities based on 10-year data, it totally changed the way I began evaluating my treatment options. In my conversations with thousands of men diagnosed with prostate cancer, I've learned most of us are concerned about 3 things. Firstly, we want to be cured of the cancer. Second, we don't want to wear diapers. Third, we want to maintain our ability to have sex. This guide empowered me to make the most of the conversations with my physicians. Before having this information, I didn't know what to ask my urologist or my radiation oncologist. Afterward, I found the conversations to be much more informative because I understood what was being said and I knew what questions I needed to be asking. This guide can do the same for you. Just fill out the form on this page or call me and I'll mail you the guide and DVD at no charge. You can also view the entire guide right now by simply clicking on the picture below. It's not very easy to read on the screen and you definitely don't want to try to print it. There's no substitute for having this book in your hands so you can easily refer to it as you continue your research efforts. I want to encourage you to do as much research as you can. Speak with more than one physician as you look for that second opinion and ask about cure rate and side effects outcome data. I wish you and yours the best on your research journey.